Welcome to the fourth quarter 2024 Indiana FADS education webinar on Applied Behavior Analysis, known as ABA. This webinar is designed to introduce billing providers to the new methodology implemented by the Indiana FSSA for coverage of ABA therapy services. It will also offer comprehensive training on the documentation requirements for ABA services. The goal is to ensure that all Medicaid claims submissions are fully supported and properly documented. This webinar is being sponsored by the Office of Medicaid Policy and Planning, or OMPP, with contributions from Lisa Copsey and Kelsey Oren. By the end of this webinar, you should be able to define ABA services, conform to the IHCP rendering provider medical record documentation requirements, distinguish covered versus non-covered ABA services, identify key IHCP and CMS regulations for ABA documentation requirements, have a better understanding of ABA billing requirements, and recognize common documentation errors and apply prevention methods. Let's start by reviewing what ABA services are.
We will begin by reviewing what ABA services are and the provider's responsibilities for ensuring the medical record documentation fully supports the claims billed for these services. According to the Centers for Medicare and Medicaid Services, CMS, Medicaid and the Children's Health Insurance Program, known as CHIP, are the largest national payers for behavioral health services, financing more than a quarter of the country's behavioral health services. Since 2016, the Indiana FSSA and its Office of Medicaid Policy and Planning pays for coverage of ABA therapy. ABA therapy is the practice of designing, implementing, and evaluating environmental modification using behavioral stimuli and consequences to produce socially significant improvement in human behavior. This includes the direct observation, measurement, and functional analysis of the relations between environment and behavior. Specifically, the IHCP provides coverage for ABA therapy when medically necessary for the treatment of autism spectrum disorder, or ASD, for members 20 years of age and younger. Applied behavior analysis is a scientific approach in psychology focused on understanding and improving behavior through behavior analytics techniques. It is commonly used to treat ASD, anxiety, and other developmental disabilities. The increasing prevalence of ASD is a significant growth driver for the ABA market. According to the Centers for Disease Control and Prevention, 1 in 36 children in the U.S. are diagnosed with ASD, up from 1 in 44, with boys being diagnosed at a rate nearly 4 times higher than girls. This rising prevalence of ASD is boosting the demand for ABA therapy as more parents, caregivers, and healthcare professionals recognize its positive outcomes. Let's examine the provider's responsibilities for ensuring that the medical record documentation fully supports the ABA services billed to Indiana Medicaid. Medical professionals have specific responsibilities when they accept reimbursement from the Medicaid program. They must ensure that the claims submitted are true and accurate, and that the medical record documentation supports and justifies the billed services. Medical record documents in support of the claim are subject to review by various parties, including employers, federal and state reviewers, and auditors. The OMPP Program Integrity Section reviews are designed to ensure that federal and state taxpayer dollars are utilized effectively in delivering high-quality and essential care, while also preventing fraud, waste, and abuse. High-quality medical billing documentation is essential for several reasons. It serves as a legal document that verifies the services provided the reasons for those services, and the necessity of the patient's visit to the provider. This documentation can be crucial if used as evidence in a court of law. Professional documentation facilitates effective communication of the treatment or care plan and clinical reasoning to other healthcare providers, ensuring continuity and clarity in patient care. And for billing purposes, thorough and accurate documentation provides a solid foundation for the rendered services and ensures compliance with regulatory standards. Now, let's review the IHCP Rendering Provider Agreement and Attestation Form. As an IHCP provider, particularly one offering ABA services, it's important to understand the connection between the Rendering Provider Agreement and Attestation Form and ABA billing requirements. In particular, by signing the Rendering Provider Agreement and Attestation Form, you are confirming that you will accurately follow IHCP's billing rules. This includes adhering to specific guidelines for ABA services, such as using the correct procedure codes, modifiers, and documentation. Accurate billing is essential to ensure that services are reimbursed correctly and in compliance with Medicaid standards. The form requires you to comply with Medicaid regulations and state and federal Medicaid guidelines, including the correct reporting of ABA services. This means that when billing for ABA services, you must provide detailed progress notes, treatment plans, and other supporting documentation to justify the claims. These practices are directly tied to your attestation that all claims will be submitted according to IHCP rules. For ABA, documentation supporting the need for services and their frequency is critical. The Rendering Provider Agreement stipulates that providers must maintain and submit accurate records, including the rationale for treatment and progress updates. This helps ensure that the services are medically necessary and align with the billing requirements. In summary, the Rendering Provider Agreement and Attestation Form is your formal commitment to comply with billing requirements and to uphold the integrity of ABA services under IHCP. By signing the agreement, you're affirming that you will submit accurate and supported claims in line with both Medicaid and IHCP guidelines. Let's examine the agreement's terms related to medical records and documentation, and how they relate to the billing requirements for applied behavior analysis. In Section 11, providers agree to abide by the state's Medical Policy Manual and IHCP Provider Reference Modules as amended from time to time, as well as all provider bulletins, banner pages, and notices. Any amendments to the policy manual or reference modules, including provider bulletins, banner pages, and notices, will be communicated on the official state Medicaid website and will be binding when made public. Section 24 states that providers agree to fully cooperate with federal and state officials and their agents as they conduct periodic inspections, reviews, and audits. Section 25 of the IHCP Rendering Provider Agreement and Attestation Form requires providers to maintain records and information necessary for the review of IHCP payments and compliance. These records must be retained according to the specifications outlined in 405 Indiana Administrative Code Sections 1-1 through 4.2 and include all relevant documentation as detailed in the policy manual, reference modules, bulletins, and banner pages. These documents will assist in verifying the appropriateness of services and charges and must be made available to the FSSA or its agents upon request. Section 25 also includes a list of the records that should be included, though this is not a complete list of possible records that may be required. Medical records as specified by Title 42 U.S. Code Section 1396A, Number 27, and any amendments. records of all treatments, drugs, and services that the vendor payments have been made or are to be made under Title 19 or Title 21 programs, including the authority for and the date of administration of the treatments, drugs, or services. Any records determined by FSSA or its representative to be necessary to fully disclose and document the extent of services provided to individuals receiving assistance under the provisions of the IHCP. Documentation in each patient's record enables the FSSA or its agent to verify that each charge is due and proper. All other records found necessary by the FSSA or its agent in determining compliance with any federal or state law, rule, or regulation communicated by the United States Department of Health and Human Services or by the FSSA, and any other information regarding payments claimed by the provider for furnishing services to the plan. Now that we have reviewed the rendering provider agreement, you may be asking, what can I do as a rendering provider to ensure I'm following these requirements? The OMPP policies emphasize 4 key areas to ensure compliance with complete and accurate documentation. Providers should thoroughly document every patient encounter. This documentation is crucial as it serves as a primary means of communicating essential patient information. Incomplete or inaccurate records can lead to unintended and potentially dangerous outcomes for patients. Also, precise documentation is vital for adhering to federal and state laws, and it plays a significant role in minimizing fraud, waste, and abuse. The OMPP Provider Integrity section offers the following best practices, based on findings and issues identified in previous audits, as follows. Make sure that each patient encounter is documented completely, accurately, legibly, and timely. Make sure the documentation clearly identifies the rendering provider and/or rendering provider employees. Make sure the documentation is signed and dated. And make sure the documentation includes details of physician involvement. Additional service-specific documentation requirements are detailed in the IHCP Provider Reference modules, as well as in the IHCP Provider Bulletins and Banner pages, the IAC, and statutes. Providers can use the following links to visit the Provider References page for more information. For historical purposes, bulletins issued before 2020 are accessible from the archived bulletins.
In this section, we will provide a high-level overview of ABA criteria and requirements. ABA therapy can be administered in 2 primary ways. It may be implemented as a comprehensive program, offering intensive intervention across various environments and situations. Alternatively, it can be part of a more targeted program, addressing specific behaviors or situations. Reimbursement for ABA therapy is provided when the appropriate qualified practitioners render these services. Members must meet specific criteria to be eligible for ABA therapy services. Let's take a look at some practitioner requirements. There are a few practitioner requirements for ABA therapy that we will cover today. This specialty is available only to providers that hold a valid professional license as a health service provider in psychology, HSPP, or a valid board certification as a master's level board certified behavior analyst, BCBA, or a doctoral level board certified behavior analyst, BCBA-D. Any ABA therapy services performed by a bachelor-level board-certified assistant behavior analyst or a credentialed registered behavior technician must be under supervision by either a BCBA, BCBA-D, or an HSPP. On or after March 1, 2018, Reimbursement of ABA therapy services will only be made to IHCP-enrolled providers for the following classifications: ABA therapists for specifically Provider Type 11 and Provider Specialty 615. School corporations for specifically Provider Type 12 and Provider Specialty 120. And as of December 18, 2024, IHCP will begin enrolling additional ABA therapy providers, ABA therapists, bachelors, Provider Type 11, Specialty 624, ABA therapist, RBT, Provider Type 11, Specialty 625. Next, we will discuss non-covered services for ABA therapy. It is important to note that reimbursement is not available when services do not meet medical necessity criteria or if a member does not qualify for ABA therapy. In addition, the following services are not covered under ABA therapy: services that focus solely on recreational or educational outcomes, such as achieving specific goals related to completing college applications and career exploration. Also, services that are a duplicate of other covered services, such as services rendered under an individualized educational program that address the same goals using the same techniques as the treatment plan. An example of this would be recognizing and describing emotional states of self and others. Let's discuss key IHCP and CMS regulations. IHCP and CMS have created guidelines to help providers understand the regulations associated with ABA therapy. This section reviews these key regulations. Let's take a look at some key IHCP and CMS documentation requirements for ABA therapy services. Keep in mind that this is not an all-inclusive list of regulations. To learn more, visit the links here or the IHCP's website. Treatment plan requirements for ABA therapy can be found in the IHCP Provider Reference Modules in the Behavioral Health Services section. When creating an ABA treatment plan, the following should be included: the identification of the individual's behavioral, psychological, family, and medical concerns, and the age-appropriate measurable goals that includes baseline measurements and anticipated timelines for achievement. The plan should include the number of hours per week being requested, with justification and supporting documentation for the specific number of hours based on the individual's needs considering the individual's age, school attendance requirements, and other daily activities. See the Service Limits for ABA Therapy section for guidelines. Ensure that the plan includes a clear schedule of services planned and documentation that all identified interventions are consistent with ABA techniques and provides a plan for the parent or guardian training and school transition where applicable. And finally, the plan should include documentation that ABA services will be delivered by an appropriate provider as described in the Practitioner Requirements for ABA Therapy section. According to the Indiana Administrative Code 405 IAC 5-22-12F, ABA therapy services require prior authorization, or PA, based on the criteria outlined in 405 IAC Section 5-3. A BCBA may also submit a PA request to the office for review and approval. The PA request for ABA therapy must include an individual-specific treatment plan as described in the Treatment Plan Requirements for ABA Therapy section. The request should also include supporting documentation with a comprehensive diagnostic evaluation, documentation supporting the number of therapy hours being requested, and documentation to support medical necessity if requested. Note, the providers can use the IHCP Applied Behavior Analysis Prior Authorization Checklist to prepare comprehensive PA requests for ABA therapy, which should reduce suspensions for requests for additional information. The checklist is relevant to PA information needed for both FFS and managed care ABA services. The checklist is available on the Indiana State Government website. The initial course of therapy may be approved for up to 6 months. To continue providing ABA therapy beyond the initial authorized timeframe, providers must submit a new PA request and receive approval. PA requests for the continuation of ABA therapy may be approved when the member continues to meet the criteria for ABA therapy. There should be documentation of symptoms that still meet the criteria for autism and would benefit from ABA. The individual-specific treatment plan should include measurable progress to date for each goal in the treatment plan, a revised anticipated timeline for achievement of each goal based on both the initial assessment and subsequent interim assessments over the duration of the intervention, and clinically significant progress in areas such as social, communication, and language skills, adaptive functioning, and behavior. Updates to any other section of the plan as applicable for the hours per week, schedule of activities, plans for parent or guardian training, and school transition must be submitted to continue ABA therapy. For any visit or treatment notes associated to ABA, the IHCP provides guidance in the 405 IAC 1-1.4-2 Medical Records, Section 2. Medicaid reimbursement is available for services rendered by an appropriate practitioner. Visit and therapy notes for services must include the following: the identity of the individual to whom service was rendered, the identity including the signature or initials of the provider rendering the service, the identity including dated signature or initials and position of the provider employee rendering the service, the date on which the service was rendered, and a statement describing services rendered, including the duration of services rendered, for example, the time in and time out. Refer to the IHCP Provider Reference Module, Provider and Member Utilization Review for documentation requirements. The IHCP Provider Reference Module, Provider and Member Utilization Review, Medical and Financial Record Retention, and 405 IAC 1-1.4-2 Medical Records Section 2 outlines that all IHCP providers shall maintain for a period of 7 years from the date Medicaid services are provided to a member such medical or other records as are necessary to fully disclose and document the extent of the services provided. Next, we will look at ABA billing requirements and ABA therapy modifiers. The Behavioral Health Services Mental Health and Addiction Provider Reference Module provides billing guidance for ABA therapy services specific to the prior authorization requirements. ABA services must be billed on a professional claim CMS 1500 form or its electronic equivalent, and the appropriate procedure codes modifier combination must be documented. Here is a list of the procedure codes modifier combination. The IHCP Bulletin BT 2024-01, dated January 4, 2024, provides the new procedure code and modifier combinations within Table 1 that are effective for dates of service on or after January 1, 2024. The table also includes service descriptions for each combination, the billing unit of 15 minutes, the associated rates, and attendee information. Next, we will discuss what each modifier is and when it is used for ABA therapy services. Table 2 within the IHCP Bulletin BT 2024-194 dated November 29, 2024, provides guidance for the appropriate billing modifiers used for ABA therapy services. The modifier U1 is used when the service is delivered by a credentialed registered behavior technician, or RBT. The modifier U2 is used when the service is delivered by a bachelor-level board-certified assistant behavior analyst, or BCABA. The modifier U3 is used when the service is delivered by a physician, doctoral-level board-certified behavior analyst doctoral, BCBA-D, master's level board-certified behavior analyst, BCBA, or health service provider in psychology, HSPP. As per Bulletin BT 2024-194, the IAHCP made additional changes for provider enrollment related to risk and certification licensure requirements for new and existing ABA therapy providers. Beginning April 1, 2025, the IAHCP will require the rendering provider NPI on a claim billed for ABA therapy services to align with the procedure code modifier, indicating the level of ABA therapy provider that rendered the service. School corporations are exempt from this requirement. They continue to be both the billing and rendering practitioners when billing for ABA therapy services. Next, we'll look at common documentation errors and preventions.
The OMPP identifies common errors during the documentation for ABA therapy and examples to prevent potential errors in the future. In this section, we will look at the review process from the medical reviewer's perspective and present the common documentation and process errors that are detected. To ensure a smooth and efficient review process, please follow these instructions when preparing your documentation. By adhering to these guidelines, you can help expedite the review process and minimize any potential delays or denials. When gathering your documentation to submit to IHCP for review of medical records, please ensure that all documents are combined into a single PDF file for each requested member. Label each PDF using a consistent title for each member, including the audit case ID number and the member's name. Here is an example of how the PDF file should be named. To ensure a streamlined review process within the file, please ensure that the documents are submitted in this order. 1. Plan for treatment for the requested date of service with a dated signature from the supervising practitioner. 2. Prior authorization approval notice. 3. Comprehensive diagnostic evaluation. 4. Visit or therapy notes in order by date of service. And 5. Other documentation needed to support the procedure code build. Note, if all of the required items are not submitted, the documents do not include a date or signature, or there is a discrepancy in the billing unit, the claim line will be fully denied. Any findings identified are preliminary until the final calculation of overpayment is determined. The provider will have the opportunity to respond to the audit and request reconsideration by submitting new or additional documentation. Now let's look at the common documentation and process errors. While conducting reviews, the medical reviewers find some common errors that can be prevented. Some of these errors are documentation dates that are missing dates of service, diagnostic evaluation without attaching or completing a comprehensive diagnostic evaluation, autism diagnosis that was not provided on the treatment plan, the treatment plan is missing from the final documentation, signatures are missing on the treatment plan, rendering provider's visit or therapy notes, patient identifiers are missing from one or more pages on the record, and billing units are not supported in the documentation. Let's look at an example with commonly seen errors and how these errors can be prevented. In the following documentation, some common errors have been made. This therapy visit note example has 2 errors. First, the number of billing units is incorrect. The provider billed for 4 hours or 16 units, but the time in, time out documentation supports 2 hours or 8 units. Next, the rendering provider's signature was missing at the bottom of the page. On the treatment plan, there was a major error of missing patient identifiers, which could include name, date of birth, Social Security number, medical identification number, and photo. In accordance with 405 IAC 1-1.4-2, Medical Records, Section 2A, Medicaid records shall be of sufficient quality to fully disclose and document the extent of services provided to individuals receiving Medicaid assistance. And in accordance with the IHCP Provider Reference Module, Provider and Member Utilization Review, Medical and Financial Record Retention, such records shall include, at the minimum, the following information and documentation: the identity of the individual to whom service was rendered. In addition, the documentation should also include the date of birth.
Let's wrap up by reviewing some key takeaways about ABA therapy. In summary, there are several key takeaways. ABA therapy visit notes must include the patient's identity, the dated signature and position of the rendering provider, and the services provided, including the time in and time out. ABA therapy services necessitate a written treatment plan or plan of care developed by a qualified practitioner or therapist and signed by the supervising practitioner. This treatment plan must incorporate the essential details previously outlined in the presentation. ABA therapy is only available to members who are 20 years of age or younger, have a diagnosis of autism, and have completed a diagnostic evaluation. All ABA therapy services require prior authorization to support the billed claim. Medical records must fully disclose and document the extent of the services provided. For more information on ABA therapy services, please refer to the references included in the PDF version of this presentation, which can be found on the Program Integrity website. The Program Integrity team has a provider education website where you can access additional training to keep yourself up to date on the latest information. Thank you for attending this session. If you have any questions, please email the Program Integrity email address listed here.